Hello, my name is Dr. Vladimir Gashinsky from Holistic Dental Center in Milton, New Jersey. And it's my pleasure today to introduce to you Amanda Fleissner. And she is an occupational therapist. How are you doing today?
I'm good.
Wonderful. I want to ask you a question.
Sure.
Since the most of the holistic practitioners have some kind of a life event and making to move to holistic treatment to help patients more, do you have anything specific to tell us?
Yeah, absolutely. My career has really been a journey, but I think it really started back when I was in high school. I was a cross-country runner, and
Wow.
I had stress fractures in my shins, and it was very painful. It was something that I loved to do, but then I wasn't able to do it anymore because, I had broken bones. And I went through the traditional healing of the bones and everything, and that was helpful, and it got me back to running, but no one ever taught me how to run correctly to prevent it so that it didn't come back. And, I didn't have sort of that help of how do I go through this traumatic injury and, how do I work through that? So over the years, I kept running. I would have sacral issues, I would have knee issues, I would have all these different issues that would pop up from time to time. And until I started doing the trainings, doing the things that I do now with my patients, I was actually finally able to heal my body. So I really kind of feel like I became the therapist that I should have had, 20-something years ago. And that I just sort of created, who I needed to be.
Oh, very interesting.
Yeah.
Do you remember any specific person who helped you first?
I feel like when I started on this journey, it was really more of a mental thing. When I got in touch with who I was as a therapist and who I was as a person and what I believed.
Wow.
I saw a therapist, and that really opened things up to me, and I realized that there's not just one answer. There's a huge range of possibilities. The possibilities are endless for healing, for the things you want to do in your life, all of those things. It really is very freeing, and that allowed me to realize how much I liked the work that I did, but how much I wanted to tailor it to what I truly believed in, which is the practice that I have now. So,
wonderful. You know that it's an amazing story. By the way, how does your patients benefit from your services?
Well, my private practice, occupational therapy practice, which is Find Relief Therapy, is a family practice. So I work with little itty bitty newborns all the way up to people in their 80s and plus, because I found over time that I would be working with a child, and then the mom would get up from the couch and say, "Oh, my back hurts." And I'd say, "Oh, what's wrong with your back?" Or I'd be working with an adult and it'd say, "I really think this would benefit my niece or my nephew." Families are so important to our culture, and the health of the family is so important that to be able to provide services to that whole range is one of the focuses of my practice. So for my little bitty babies, I do a lot of craniosacral therapy, which is one of the therapies that I'm trained in. I work with them. Actually, I work with a lot of dentists with babies pre and post lip tie and tongue ties. I do children when children have constipation, anxiety issues, autistic spectrum issues, developmental disorders, just the whole gamut for kids. And then with adults, I do a lot of chronic tension issues, repetitive stress injuries, anything low back tension, neck tension, shoulder tension, carpal tunnel, plantar fat, head to toe. If you have chronic tension in your body, and it is impacting the way you're able to function in your everyday life, that's the client that I love to work with, and that's the client who benefits from the therapies that I do the most.
Wow.
Yeah.
Basically, everyone benefits from your therapy.
Yeah, I mean, if you have tight neck and shoulders or tight low back, I use a modality called push therapy, and it is really, really revolutionary because it not only treats the body, but I do manual treatment on the body to release chronic tension that's constantly in the muscles there 24 hours a day. Mm-hmm. You release that tension, but then you also train the body. You do training exercises to release tension and to build strength.
Wow.
Because one of the things that I found is, you can do an exercise, or you can have a nice massage, or, you can get some kind of treatment. But if you don't fundamentally change the way that you're using your body in your everyday life, those changes are going to be temporary. And I like making permanent changes. I like finding solutions. I like getting to the source of what's going on. Why is this happening? And it could be a physical reason, or it could be an emotional reason, which is where, my start in mental health. I actually started as an occupational therapy in mental health, and then switched to more physical disability. So I've kind of experienced both worlds, both personally as well as professionally. And, when somebody comes into my office, I feel like we go on a journey of helping them explore, where is this tension coming from? Is it coming from the way that I sit at my desk for 10 hours a day, hunched over a computer? Or is it going on because I had a traumatic car accident 10 years ago that has left me with some emotional trauma that I've held in my body and I need to release? And so helping the person try and, figure that out and then release that, either physically or emotionally, that's what makes real permanent change.
I love it. That helping the person, it sounds like a mission statement.
It is my mission statement. I look at the whole person. I mean, that's what an occupational therapist does. You look at the whole person within the context of their life. But I've used it for my own life. I walk the walk, but I also really believe that if that's what you're looking for, that can be the most helpful. It's not a Band-Aid. It's a solution.
Amanda, what is a quick tip, somebody who listens to this tape can just take it from this conversation?
I would say a quick tip that they can take is, when you are using your body in your everyday life, and when you are exercising or training your body, relaxing, keeping your joints and your body relaxed. A lot of people think like, I gotta build muscle, like I'm gonna get really strong and really get get really strong and bulky. But the more relaxed and grounded you stay in your work and in your everyday life, the more your body is soft and supple and mobile and strong and and able to move through your everyday life. So even, and that could be in the gym, or that could be standing at the sink doing dishes. If you're standing at the sink doing dishes like this, tensing your shoulders, arching your back, you're putting tension into your body. So relax yourself. Take a breath. Relax your joints. And then start to move through your day. And that's a tip.
That's great. Where are you located, and how the people can find you?
Well, I am located in West Orange, New Jersey. And I also have an office there, and I also am in an acupuncture practice called AcuSource Healing in Cedar Grove, 1 day a week. And you can find me on my website, which is findrelieftherapy.com. You can email me, or you can call me directly.
And what is your phone number?
My phone number is 973-768-5139, and you can also reach me at findrelieftherapy@gmail.com.
Wonderful. Thank you very much. It was a pleasure to have an interview with you.
It was really great talking with you. Thank you.
Thanks.